Welcome back to my YouTube channel. In today's video, we'll be looking at the anatomy of the sciatic nerve. Okay, so studying the sciatic nerve, we're going to look into the origin of the sciatic nerve, the cause of the sciatic nerve, the branches of the sciatic nerves, and the clinical anatomy of the sciatic nerve. Okay, so looking at this model, we will notice the spinal nerves. Okay, so these are the spinal nerves. This is L1 spinal nerves, L2, L3, L4, L5. So these are the lumbar spinal nerves. So this one forms the lumbar plexus. Okay, so we also have the sacral plexus as well, which are the S1, S2, S3, S4, and other ones S4 and X5 spinal nerves. And then we have one coccygeal nerves, which we cannot see in this model. So these sciatic nerves, it originates from L4 to S3 spinal nerves. So these spinal nerves, they are coming from the spinal cord. So they now transverse within this opening here, this hole. This hole is called the intervertebral foramen. So these spinal nerves are now coming from intervertebral foramen within this spinal cord. So this yellow stuff you're seeing here is the spinal cord, giving off this right and the left spinal nerves. Okay, so we say that the sciatic nerve originates from the L4 to S3 spinal nerves. So this sciatic nerve has two components. We have the tibia component that originate from L4 to S3. So the tibia component originates from L4 to S3. While the fibular part originates from L4 to S2. Okay, so to repeat that again, the tibia component originates from the L4 to S3, while the fibular component originates from the L4 to S2. So when these two of them come together to form, they now enter into this hole here, this notch here. So this one is called the greater sciatic notch. And here is called the sciatic, this here is called the ischial spine. And below the ischial spine, we have what we call the lesser sciatic notch. So the greater sciatic notch is demarcated from the lesser sciatic notch by this spine here called the ischial spine. So this notch here are being formed into foramen by a number of ligaments like sacrospinous ligament and the sacrotuberous ligament. So they turn this notch here into foramen. So when this sciatic nerve from L4 to S3 now come together to unite, they now enter into this greater sciatic notch and then enter into the pelvis. So we are going to look into cadaveric study to appreciate the cause of this sciatic nerve and how they form branches and their cause. Okay, so we are now looking into this sciatic nerve to see the cause of this sciatic. So immediately they have formed and enter into the greater sciatic notch, they now run beneath this muscle here. So this is a muscle here called the piriformis muscle. So this piriformis muscle is a landmark muscle of the gluteal region. So this muscle here demarcates the superficial muscles and the deep muscles. So we see that the sciatic nerve runs beneath this piriformis muscle. So as they run beneath the piriformis muscle, they now runs anterior to this muscle here. So this muscle here is called the quadratus femoris muscle. So as they run anterior to the quadratus femoris muscle, they now start running down, leaving the pelvic, and then entering into the posterior compartment of the thigh. So as they get into the posterior compartment of the thigh, they now runs anterior to the adductor magnus, the hamstring part of the abductor magnus, and they also lies posterior to the biceps femoris muscle as they enter into the popliteal fossa. So as they are about to enter into the popliteal fossa, mainly medial lateral to the distal third of the femur, they now bifurcate into the tibial nerve and then common peroneal nerve. So in most of the clinical abnormalities, about 15% of people have their sciatic nerve perforating this muscle here called the piriformis muscle. So these people tends to have what we call the piriformis syndrome, where this piriformis muscle can be contracted, can be irritated, pinching or compressing this muscle, this nerve here called the sciatic nerve. So this can lead to numbness, this can lead to pains radiating all through the lower limb. So in another abnormality as well that we can see within the model here, where we can see what happened in sciatica. So let's look at this model to see what happens when there is sciatica as well, using the model. Okay, so looking at this model, we can see what normally results sciatica. So this L4, L5, and sometimes this S1 here are prone to undergo sciatica, where there is a compression of this spinal nerves that contributes to form the sciatic nerve. So most times or sometimes we notice that this intervertebral disc can herniate and then pinching on these spinal nerves. So this herniation of this intervertebral disc can herniate and then pinch on these spinal nerves, thereby causing radiation of pains on the lower limb. So this is called the herniated disc, resulting sciatica that leads to pain. Sometimes we notice that this disc as well can be degenerated. We call it degenerative disc disease, where this bone here will be sitting on the next bone, thereby pressing or compressing these spinal nerves, leading to sciatica. Okay, so these are some of the clinical abnormalities that we have for the sciatic nerve. Thank you and see you on our next video.